Let's talk about clinical decision making. These are the learning objectives we're going to address. Describe and define the components of the nursing process. Discuss how the nursing process relates to problem solving, decision making, and critical thinking. Employ methods of data collection to select appropriate nursing diagnoses, goals, and outcomes for individuals across the lifespan. Illustrate clinical decision making utilizing a nursing care plan. Construct a concept map that incorporates a holistic plan of care for the clients across the lifespan, and utilize a concept map and nursing care plan to identify and implement nursing interventions for clients across the lifespan. So what is the nursing process? As our nursing process, we use the mnemonic ADPI. What does ADPI stand for? It stands for Assess, Diagnose, Plan, Implement, and Evaluate. Assess is when the nurse gathers information about the patient's condition. After that, we move on to diagnose. This is where we identify what exactly is the patient's problem. After that, we move on to plan. We want to set patient goals or outcomes of care and identify the appropriate nursing actions to achieve the patient's outcomes. Then we move on to implement. This is where the nurse is going to perform actions to help the patient achieve their outcomes. After implementation, we move on to evaluate. This is where the nurse determines if the goals or outcomes have been achieved. As part of the evaluation process, the nurse also needs to look at each of the interventions and determine if the interventions were appropriate for the patient. Information, you're going to create a database. Your types of assessments is going to include that patient-centered interview during the nursing health history, a physical examination, and the periodic assessments you make during rounding or administering care. Here a nurse is assessing her patient. She's actually observing the male patient lying in the bed, and he appears to be uncomfortable. He presents with some discomfort in the surgical area, and she discovers this upon her physical assessment when palpating the abdomen. These are the cues that the nurse is picking up on. He's lying very still with the arms along the sides. He seems very tense. He states he hasn't turned for some time, so upon further examination, further investigation, the nurse learns that he's reporting a pain of 7 on a scale of 0 to 10. From all of this information, the nurse is making an inference to that the pain is severe and the pain is limiting the patient's ability to move and reposition himself. Here's a grid that kind of shows how the patient data helps the nurse determine patient's problems. The data that she gathered, the patient's lying in bed and grimaces when he's turned. The patient states yes when she asks if he's having any pain. The patient places his hands between his legs and says, "It's where I had surgery." "Oh, it's a 7, patient states. Okay, when was the last time patient turned? "Not since the nurses turned me last night." Okay, nurse asks, "May I look at your incision?" The incision is closed with some swelling, but no drainage. So she's taking one question, "Are you having any pain?" and she's using follow-up questions to gather more data. So what's our types of data? Remember when you went over physical assessment, there's 2 types of data, subjective and objective. Our subjective is the patient's actual verbal descriptions of their health problems. This is what the patient is going to state. Objective is what the nurse actually visualizes, what the nurse observes. Sources of data: the patient, family, or significant others with the patient's permission, healthcare team, medical records, other records, and scientific literature. You get a lot of information from literature. And of course, the nurse's experience. Has the nurse seen a patient with similar signs and symptoms? The patient-centered interview is a relationship based on the organized conversation that the nurse is having with the patient. Your motivational interviewing is often used in counseling and actually allows the nurse to become a help to the patient in the change process. We talked a lot about communication and collaboration. Your interview techniques, you're going to have a lot of opportunities for observation. You're going to observe those nonverbal cues such as eye contact, body language, the tone of the patient's voice, and that can actually give you additional data that you can use to create an appropriate nursing care plan. Always ask open-ended questions. You get a lot more information with that. If the patient is very closed and walled off and not giving you a whole lot of information, follow up with leading questions. Okay, you just told me that you're hurting. Can you tell me where exactly you're hurting? It looks like you may be hurting in your belly since you're holding it. Back channel. That's when the patient may mention something and then move quickly on to another topic, but you want to get more information about what they mentioned previously. So you backtrack and say, okay, tell me more about that car accident you had yesterday. And then you can always use direct closed-ended questions. Don't necessarily discount those questions. They're not the best way to get information, but you can always ask a closed-ended question and come back with more follow-up questions to get the information that you need. Always consider the patient's cultural background. Okay, you need to make sure you have a firm understanding of what their background is as far as their culture is concerned. What's the best source of information for that? Your patient. Okay, I'm not familiar with taking care of patients who are Muslims. Can you tell me a little bit about your culture? The patient is going to appreciate you wanting to know more information about that background. Plus, it gives you the information about how that patient would like to be treated. And of course, if you're not quite sure about what a patient is saying, always make sure you ask for clarification. All right, quick quiz for you guys. Patient is admitted to the hospital with shortness of breath. As the nurse assesses the patient, the nurse is using the process of A, evaluation, B, data collection, C, problem identification, or D, testing a hypothesis. What do you guys think? Correct answer is B, data collection. You get your information about your patient through many sources. Assessment is the primary source. Assessment is always going to be the first stage of the nursing process, and you need that information to be able to adequately develop a nursing care plan. So what are the components of a nursing health history? Well, first thing, biographical information. Okay, how old is your patient? Is your patient male or female? The reasons why they are seeking health care. Can you tell me why you came into the hospital for this visit? Get their health history. Do you have a history of any medical problems that we need to know about? Do you have any surgical history? Get their psychosocial history. Do you smoke? Does anyone in the home smoke? Do you feel safe? Do you live by yourself? Do you have stairs? Do you work? What kind of environment do you work in? And then you're actually going to perform your physical assessment and do a review of all of the body systems. Make sure you get the patient's expectations. And the best way to do that is to ask the patient, what do you expect to gain from this hospitalization? What is the patient's present illness or health concerns? The patient may be in for one thing, but they may be concerned about something else, and you're not going to find that out unless you ask the patient. Get a family history. Okay? Patients in with high blood pressure, so you ask, Does anyone else in your family have a history of high blood pressure? Ask the patient about their spiritual health. If they are concerned about being in the hospital because instead of being able to attend Mass, they're not going to have their full thought process on getting healthy. So we need to make sure we address that spiritual health and collaborate with other members of the healthcare team, such as the chaplain, to help accommodate their spiritual concerns. Are there anything else that you guys can think of that might be part of the nursing health history? Think about it. So why is observation of patient behavior so important? Okay, it actually adds depth to our observations, okay, our observational assessment. We look at a patient and they are grimacing and they're crying, very, very tearful, and you ask them how they're feeling today and they tell you, oh, I'm feeling great. What does your observation tell you? Your observation says, I don't think they feel so great. Something else is going on. So you need to gather more information to follow up on that observation. Don't ignore their diagnostic and laboratory information. Look up their labs. As you guys progress into 112, you're going to have opportunity to look at lab values and start to correlate the lab values to the patient's conditions. Same thing goes with diagnostic studies, your x-rays, your CT scans, your MRIs, and so forth. You want to interpret and validate all of that assessment data. You're going to correlate with what you see in the laboratory and diagnostic studies to what you actually observe and assess in your patient. That's going to all lead up to that second step of the nursing process, the diagnose. Make sure when you're doing your documentation of your data, you use very clear, concise, appropriate terminology. You know, we've been saying you need to learn your medical terminology. This is why. This is going to become a baseline for the patient's care throughout their hospital stay. Your concept map, we're not going to have an opportunity to play around much with concept mapping because of the online lecture. However, think of a concept map as a visual representation of your data. Okay? You have a bubble here, bubble there, bubble here, and you can kind of organize all of your data to determine what's going on. A little bit more on concept map. A concept map is going to help you critically think about the patient's diagnosis and how they relate to one another. It's going to help organize and connect the data from multiple diagnoses in a logical manner. It is a visual representation of all the connections amongst the concepts that relate to that central subject. And in this case, the central subject is your patient. Your data clustering is you're going to actually cluster all of the clues and signs and symptoms gathered during the assessment and put the like data with the similar data. Okay? Data clusters are compared with standards to reach a conclusion about the patient's response to a health problem. Each clinical criterion is going to be an objective or a subjective sign, symptom, or risk factor that when analyzed with other criteria is going to lead to that diagnostic conclusion. Here's another quick quiz for you guys. The nursing process organizes your approach to delivering nursing care. To provide care for your patients, you need to incorporate nursing process and A. Decision making, B. Problem solving, C. Interview process, or D. Intellectual standards. The correct answer is C. The interview process. It is a very important part of patient-centered care, and you're going to continue that interaction with patients throughout their stay at the facility, no matter what stage of the nursing process you're in. So let's talk about the history of nursing diagnosis. Nursing diagnoses have been around for quite some time. They were first introduced in 1950. In 1953, Fry actually proposed the formulation of a nursing diagnosis. In 1982, the North American Nursing Diagnosis Association was established in 1982. Sorry, guys. The purpose was to develop, refine, and promote a taxonomy of. The diagnostic process requires you to use that critical thinking. We've talked quite a bit about use your critical thinking, use your critical thinking. That's going to help you to be thorough, comprehensive, and accurate when identifying the nursing diagnoses that apply to your patients. The diagnostic reasoning process involves using the assessment data gathered about a patient to logically explain a clinical judgment or a nursing diagnosis. So, data interpretation. Okay, so we have all this data that we've collected from our assessment, patient interviews, patient's records, family members, laboratory diagnostic studies. Okay, so now what? We need to make sure that we're picking the correct nursing diagnosis label for that patient's needs. When comparing patterns, you want to judge whether the group signs and symptoms are expected for a patient with that current condition. This is where your knowledge and your research of your scientific literature is going to take place. And then you need to compare what the patient is actually displaying and whether or not they are within the range of an individual's normal health responses. Once you isolate all of those characteristics, all that data that's not within that healthy normal, then you can identify what the specific problem is. Now we are ready to formulate a nursing diagnosis statement. You're going to identify the correct diagnostic label with associated defining characteristics or risk factors and a related factor. A related factor allows you to individualize a nursing diagnosis for a specific patient. The NANDA provides the list of the actual nursing diagnosis labels. But keep in mind, one size does not fit all. One label is not going to fit all patients. That related to piece is going to be the determining factor for making it specific to your patient. So here are the steps that I want you guys to use when developing that nursing diagnosis statement. The first thing you're going to do is to collect your data. Again, you're going to do this through your assessment, your patient research in the patient's chart, interviews with the patient and family members, diagnostic studies, laboratory findings. Then you're going to use all that data, cluster it together to determine your nursing diagnosis label. Now, your book has a list of nursing diagnosis labels, but it doesn't really give you a description of them. That's why I have placed a link for you guys to access the StatRef database that's located on the Fayetteville Text Library page. They have a nursing diagnosis handbook available for you guys to use. Please use that resource. It lists every single nursing diagnosis along with defining characteristics of each label. Look at those defining characteristics. Do those defining characteristics compare to the data that you've collected for your patient? If they are similar, then that would be an appropriate nursing diagnosis label for your patient. The next step is going to be determine your related to. Okay, this is what's the reason why this nursing diagnosis label is appropriate. What exactly is going on with the patient to make this nursing diagnosis label appropriate? So for an example, here's a sample nursing diagnosis statement with those three parts. Acute pain is the actual nursing diagnosis label. Related to physical injury, that's our related to statement. This is what's going to make it specific for our patient. As evidenced by is the data that you've collected. In this case, the patient's statement my ankle hurts, and the report of pain a 9 out of 10. This 3 parts is going to consist of a complete nursing diagnosis statement. Again, you need to consider culture. Okay? How has this health problem affected you and your family? What do you believe will help or fix the problem? What worries you the most about this problem? Which cultural practices are important to you? Ask these questions before selecting your nursing diagnosis. Being aware of a patient's culture and sensitive to their cultural needs is going to make your accuracy better when developing a nursing diagnosis statement. Another quick quiz. Concept mapping is one way to A. Connect concepts to a central subject. B. Relate ideas to patient health problems. C. Okay, so application to care planning. When you learn to make an accurate nursing diagnosis, your care plan is actually going to communicate the patient's healthcare problems to other professionals. Your care plan is that exactly what it is. It is a plan of care that the next nurse and the nurse following can follow along, and everybody can be on the same page in providing the best care for that patient. That nursing diagnosis is going to make sure that you pick a relevant and appropriate nursing interventions to help the patient achieve their outcome. Well, the first thing you need to do is to establish priorities. You guys have had a little bit of experience about prioritization, but here we're going to talk about how to make things easier for you. Ordering a nursing diagnosis and patient problems uses determinations of urgency and or importance to establish a preferential order for nursing interventions. Which one is going to be the most important thing to do first? Organization of a vision of a desired outcomes. You can have lots of ideas for patient outcomes, but what's going to be the most important thing to accomplish? Your classification of priorities includes a high, which is an emergent, meaning it's got to happen right now. An intermediate, which is not life-threatening, but important. And then you have a low, that may affect the patient's future well-being, but it's not a primary concern at this moment. The order of priorities may change as the patient's condition changes. Your priority settings begins at a holistic level, meaning the entire patient, okay? When you identify and prioritize a patient's main diagnosis or problem. Patient-centered care requires you know the patient's preferences, values, and express needs. You need to involve the patient in the creation of the care plan. And of course, ethical care is always a priority. So this is one of the tools that we use as nurses to help with our prioritization of care. Okay, look at that bottom level. Breathing, food, water, sex, sleep, homeostasis, excretion. The physiological needs that we all must have in order to survive. Okay, these are going to be absolutely essential. Your next level is going to be your safety. The security of your body, employment, resources, morality, family, health, and property. Okay, safety is going to be second. Okay, so you walk into a patient's room. Your patient has all 4 bed rails down. The bed is high up in the air. There's cords everywhere. They've got some throw rugs in there. And then you notice your patient's not breathing and they are blue. What's going to be the priority? Well, I hope you guys chose breathing, because if your patient's not breathing, safety is not really going to make much of a difference. Again, you want to make sure you address the physiological needs of the patient before addressing the needs of safety. Maslow's hierarchy of needs is actually going to help you answer NCLEX style questions involving priority. Be familiar with it. Okay. Now we're going to develop a goal, an outcome. Okay. There is a difference between goal and outcome. Sometimes you'll hear us refer to it interchangeably, but there is a distinct difference. A goal is just a broad statement that describes the desired change in the patient's conditions, perceptions, or behavior. That's the aim or the intent, the end result. When creating that goal outcome, always make sure you collaborate with the patient when setting their individual goals and outcomes. Okay? You are more likely to get compliance from the patient and family members if you involve them in the patient's care plan development. Always act as the patient's advocate. You want a patient-centered goal. Okay? Your patient outcome is patient specific. What will the patient do? What will the patient accomplish? Your nursing sensitive patient outcome is a measurable patient, family, or community state, behavior, or perception largely influenced by and sensitive to nursing interventions. Okay? So, first step is to create the nursing diagnosis statement. Next step is to create the patient-centered outcome. These outcomes, you're going to see nursing outcome classifications in your nursing diagnosis handbook, NOC. Use these outcomes to help specialize, personalize the outcome for your patient. Now, when writing your expected outcome, it's got to be patient-centered. Okay, absolutely has to be patient-centered. But then we're going to say, make a SMART outcome. What does SMART mean? Specific, measurable, attainable, realistic, and timed. But what does all of that mean? Well, specific means it has to be specific to the patient. Okay, what exactly is the patient going to accomplish? Measurable means that you have to have some way of determining whether or not the patient achieved that goal. Attainable, okay? Can the patient get that outcome? Can they achieve that goal? Realistic, well, is it realistic for the patient to achieve that goal? And then you have to have a time frame where the patient will achieve that goal. At what point should that patient have accomplished that outcome? Now we're ready for nursing interventions. Nursing interventions are the things that the nurses are specifically going to do to help the patient achieve their outcome. The nurse will statement. In order to select appropriate nursing interventions, nurses need to know the scientific rationale for the intervention, possess the necessary psychomotor interpersonal skills to perform that intervention, and be able to function within a setting to use the healthcare resources effectively. It's not appropriate to list a nursing intervention that a nurse cannot do. So what are the types of interventions? You have nurse-initiated interventions. These are things that the nurse can do independently. For example, having the patient cough, deep breathe. Take those deep breaths and cough. That is an independent action that the nurse can do. Your next type of intervention is your healthcare provider intervention. This is a dependent. This requires an order from a physician or other healthcare professional. So you cannot say the nurse will give a Tylenol unless you have an order to give the patient Tylenol. Collaborative is an interdependent. This is where we're going to collaborate with other healthcare disciplines. It requires a combined knowledge, skill, and expertise of multiple healthcare professionals. If your patient has problems with mobility, who are you going to collaborate with? Physical therapy would absolutely be appropriate. So when preparing a physician-initiated or collaborative intervention, don't automatically implement the therapy, but determine whether or not it's appropriate for the patient. If the patient has been bedbound for years and years and years, you know they have a problem with mobility. But in that case, would it necessarily be appropriate to collaborate with physical therapy to get them walking down the hall? Make sure you're able to recognize incorrect therapies. Okay, that's just as important, especially when giving medications or implementing procedures. Okay, you're not going to administer a medication that the doctor has ordered if the patient is allergic to that medication. So let's talk about NIC. We've talked about NANDA, we've talked about NOC. This is NIC. NIC is our nursing interventions. Okay, the NIC model is going to include the 3 levels. It's going to include the domains, the classes, and the interventions. And of course, your NIC interventions are going to be linked with the NANDA nursing diagnosis. So when you use your nursing diagnosis handbook to look up the nursing diagnosis, you're going to look at the defining characteristics. And then you're also going to say suggested related tos, and then you're going to see nursing outcome classifications, your NOC. That's going to help you establish the patient outcome. And then you're going to see the NIC, the nursing interventions classification. That's going to be a guideline for you to determine what would be appropriate interventions for the nurse to do. Your nursing care plan is going to consist of the nursing diagnosis statement, your goals, expected outcomes, and your nursing interventions. But then you're also going to have a section for your evaluation. Okay? Your evaluation is going to be able so you can appropriately identify whether or not the patient's needs have been met. This is going to that evaluation is going to reduce the risk for incomplete, inaccurate, or incorrect care, and it can also change as the patient's problems and status change. So you wrote a beautiful care plan and you come in the next day and the patient has completely flipped a 180 and the care plan is no longer applicable. That's okay. The care plan is supposed to be dynamic, always changing to fit the patient's needs. That's the purpose of the evaluation. So your clinical judgment, that's going to include making appropriate conclusions about interventions, making sure they address the patient's response to the health conditions or the process. And it can also require the nurse to either modify the approaches and sometimes create brand new care plans. Always reassess the patient. It's a continuous process. As long as you have interaction with the patient, you're going to continually assess the patient. As you're assessing the patient on a regular basis, you also need to be going back to that care plan and reviewing it and revising it. That's why the evaluation is so important. Has the patient been able to accomplish the outcome? Are they even able to accomplish the outcome? Is it out of reach for the patient? Is it inappropriate? Okay, well, if the outcome can't be reached, why? Take a look at the interventions. Are their nursing interventions appropriate for that patient? Think about that bedbound patient. It's not going to be appropriate to get that patient up and walking 20 yards down the hall. But what would be an appropriate intervention for that immobile patient? Perhaps that patient could utilize a trapeze set to help pull themselves up to improve their mobility. Make sure you have all of these things available for implementation. You need time management. Okay, if you don't have time to do a nursing intervention is not going to be successful. You need to make sure you have the appropriate equipment. Well, suggesting a trapeze for a patient is not going to be very effective if you don't have any trapeze equipment on the unit. Make sure you have adequate personnel. If it is a two-man job, you need to make sure you have 2 people available. Assess the environment. Is the environment appropriate for the implementation? And then obviously, it's patient-centered care. Look at your patient first. You want to prevent any complications to the patient. Make sure you identify the risks to the patient. Adapt the interventions to the situation. That's the beauty with care plans. It's always changing. It's patient specific. It's always evolving. Evaluate the relative benefit versus the risk. And always initiate risk prevention measures. Safety, safety, safety. Identify areas where you may need help, okay? Get information about a procedure. Don't do something you're not familiar with. Get more information. Make sure you have all the necessary equipment. And by all means, ask for help. You are responsible for knowing when one type of implementation skill is preferred over another and for having the necessary knowledge and skill to perform each. This includes your cognitive skills, your interpersonal skills, and your psychomotor skills. This is one reason why we have the skill validations. We need to make sure that you are adequately prepared to perform those skills. Achieving patients' goals. The nurses are going to implement care to meet the patient's goals. Again, the nurses are going to do the interventions to help the patient accomplish the patient outcomes, patient goals. At times, you may need to have multiple interventions to help the patient achieve their outcomes. Prioritization is going to help nurses anticipate and be able to sequence the nursing interventions in an appropriate sequence, appropriate order. Make sure the patient is able to adhere to the nursing interventions and goals. If the patient can't work with the nursing intervention, then you're going to need to make adjustments otherwise. So this is what I would like for you guys to do. Okay, I want you guys to develop a care plan for Maggie here using a NANDA approved nursing diagnosis label, a related to, along with your as evidenced by statement, an appropriate SMART patient-centered outcome, and at least 2 nursing interventions. Okay, this is 52-year-old Maggie who came into the hospital with reports of abdominal pain. She was diagnosed with a small bowel obstruction and underwent a laparoscopic colectomy. 2 days after surgery, she reports nausea and the inability to eat and keep liquids down. Develop a care plan for Maggie. Okay, so your first step is to collect your data. Do your assessment. Your assessment data is going to be the as evidenced by. Once you have all of your data, refer to the nursing diagnosis handbook that's located in StatRef and pick an appropriate nursing diagnosis label. Look at the defining characteristics. Is that nursing diagnosis label appropriate? Then you're going to determine the related to. With your related to, be careful. Do not use a medical diagnosis in your related to. You're not doctors. Okay? You are nurses. So be careful with that. Once you have those 3 elements, this is your nursing diagnosis statement. Then you're going to create your SMART outcome. Your patient outcome must be specific, measurable, attainable, realistic, and timed. Once you have your SMART outcome, then you're going to develop 2 nursing interventions. What will the nurse do to help the patient achieve the outcome? Please post your nursing diagnosis care plan, outcome, and interventions on discussion board by the assigned time.